Yes, so presenting this work, you may be familiar with Embrace. I should probably say I'm not an obstetrician, I'm a physiotherapist, so I wasn't familiar with Embrace, but thank you. It's a report into maternal deaths, and they and others identify that cardiac complications in pregnancy have a significant mortality. And to address this, we've developed a simulation course, a one-day course of scenarios that perhaps you'd be familiar with, and those are there in that little diagram. And it was a multi-professional course. We trained 84 participants, obstetricians, anaesthetists, midwives, and physicians. And looking at the outcomes of identifying their knowledge, having the knowledge around cardiac disease in pregnancy, and then also being able to manage it. It was suggested a 50-50 technical and non-technical course, and so another outcome was looking at people's human factor skills and a systematic approach to managing these patients. And essentially, if I present to you the outcomes of the course, which were assessed pre and post course, participants reported, well, we found that there was a significant increase in knowledge and ability, or knowledge and how to manage these emergencies. And also found a statistically significant increase in participants' human factor skills. And I'm not sure, you may be aware of the HFSHE, or the Human Factor Skills for Healthcare Instrument, which is a validated outcome measure for self-reported confidence in human factor skills, which also reported a significant increase pre and post course. Then what we did was undertook some 6-month follow-up data to try and see what retention of knowledge there had been. And I don't have enough data, unfortunately, from 6-month follow-up to give you statistically significant changes. But I can report a particularly warming story of a registrar, an ED registrar, who had picked up a patient returning to A&E with persistent, I think it was chest pain, or it may have been central back pain, which transpired to be a dissecting aorta, which hadn't been picked up in their first attendance at another accident and emergency department. And through this participant's newly found knowledge is what they attributed it to. They were able to identify that and manage it, and they didn't know what the outcome of the case was, but it was managed not as an emergency, so we would hope that there was a good outcome in that circumstance, which I felt like, for training 84 participants to identify one dissecting aortic aneurysm was probably a good outcome.
Thank you.